welcome to our next voyage on T-10, the show with 10-minute takes on the future of education and healthcare. I'm your host, Tim Fitzpatrick. On today's voyage, you'll hear from Dr. Raihan Faroqui, the head of medical affairs at Guaranteed, a company that aims to address an area that concerns us all, yet modern medicine often neglects, and that is death. You may have seen Guaranteed's recent coverage in Axios or MedCity News. They just came out of stealth with a $7 million seed raise to blend at-home treatment with cutting-edge technology. Their company tagline is, "We should probably talk about death." One thing that stands out to me is, and you'll hear in a few minutes, is how deeply Raihan and his team care about the problem that they're solving. Their lived experiences really shine through into their work, and I encourage you to connect with Raihan and to follow along as the team makes difficult moments easier for countless families in the coming years. We are ready to go. Please enjoy my conversation with Dr. Raihan Faroqui, Head of Medical Affairs at Guaranteed. All right, Raihan, welcome to the show. So good to have you on. I want to jump right into it and ask you, why is it so important to modernize the end-of-life care experience?
Tim, thanks so much for having me on. When we look at what people want for their end of life, we find that 75% of people want to age and die at home, but only 25% of people are able to. So that gap is what we are trying to solve and really honor the wishes of people, their families, and their loved ones by enabling kind of comprehensive care at the end of life.
And I love this. And just having, obviously, a huge supporter of your mission and having connected with you and your team in the past, I know one thing that surprised me and that I love about how you think about this space and what you're trying to build is that it is not just a single period point in time. And I know so many people, myself and my family and others impacted by this phase of life, think about it in that way. So I'd love to have you kind of dig deeper on how you think about the process and where it starts and obviously where it continues, I guess to say.
Yeah. We have a saying here, we should probably talk about death. But what we realize is that, we want people to die how they live. So it's really important to understand how people live. And that can happen much earlier than when folks traditionally start to think about death. It can happen when you're younger, it can happen when you're middle age. And really, it's the comprehensive experience of your life, the types of people you want by you, the hobbies and the passions that you want to do, the type of care in terms of who is seeing you, how they're speaking to you. So we think a lot of that needs to be done much earlier than it's traditionally done in our system, which is you have maybe a couple of months left. Families and loved ones are scrambling to get things in preparation. And, we're hoping to kind of reframe, when that advanced care planning, when your hospice service benefits, all of that can be kind of planned much more upstream.
Yeah, that's such a great idea. Obviously would have been tremendously valuable in our circumstances, in my own personal circumstances, the whole idea of starting the conversation earlier and actually helping with what that conversation should sound like. And I know one thing that resonated with that I've heard you talk about and your team is how to frame those questions around what does a good day look like, and then really building that into how this all pans out. I'd love to have you talk through also, what does that support and conversation structure look like for the extended family? I know you talk frequently about bringing in more support around the entire process. Yeah. What are some of those aspects that the team is kind of focused on and building?
We're planning on doing a family admission, which is a novel concept in healthcare. So we are treating and caring for the patient. We are also treating and caring for the family. Family does tremendous amounts of unpaid labor for aging and dying people. So it's important for us to understand what the needs and the wants of family are. And typically there is something called respite care, in hospice. But what is upstream of respite care? What does people are busy, they take time away from work, from other family caregiving duties to care for their loved one at the end of their life. But what are your needs, and how do we service that? On the flip side, we also realize that family is the frontline provider as part of the care team. And how do we also enable family to practice at the top of their license? So that means training, upskilling, and understanding what family and caregiving support, looks like. So, we're really looking at family and caregiver on both sides of the patient, the traditional patient and like provider lens, if that makes sense. But having them be front and center. So that includes, kind of virtual support, having a care concierge model that is available to you via text, via video, kind of self-service portal, and having that connectivity to a care team that can help you care for yourself, but then also enable you to care for your loved one better.
This is so exciting just to hear, because it's not an area that has had a company, especially a company with yourself and your team, that is just an exciting team to have together. Really take a hard look at what can be done better. So it's really encouraging and heartening to hear that you're focused on this space. I'd love to kind of hear your connection here. Obviously, this is an exciting time. I'm sure people will be familiar with the company and the news recently, and we'll make sure we include all of that recent kind of press in the show notes. But could you talk to us a bit about the connection and kind of what drew you to the mission and the team that you're surrounding yourself with?
Yeah. Tim, death is guaranteed. But what's not guaranteed is a really great way of dying. And I had really severe COVID in March of 2020. I come from a family of providers, physicians, therapists, nurses, my sisters, my cousins. And we believe my dad, who's a retired respiratory therapist, brought the virus home from the hospital before we had PPE. But I was the first one to get really sick. And I had COVID, severe COVID, for almost 10 days, 103, 104 fever. Day 9, I couldn't breathe. My oxygen saturation was decreasing. And I was admitted into the hospital. And I thought, I might die today. I looked at my mortality in the face for the first time in my life. And it was deeply uncomfortable. But at the same time, I had this awakening that I need to deal with some things in my life. So looking back, it was actually the most wonderful experience in my life, seeing my death in front of my eyes. And after I got better, it was probably the best I've ever lived, right? So actually thinking about your death enables you to live the best life that you possibly can. And you will hear that from folks who've had near-death experiences or who've had a really serious illness or a condition and recover. But at the same time, I also ended up giving COVID to my grandma, who lived at home with us. She is on dialysis. She does not speak English that well, has a host of health inequities, and she got severe COVID. She was in the hospital for 6 weeks. She was on the ventilator for 10 days. And miraculously, she survived. So I thought about her death all the time. And we were not prepared for a good death. It would have been a terrible death because of the pandemic and being remote and not being in the hospital. So that, to me, kind of those two experiences together, really confirmed my interest in this space in terms of a health tech innovator, but also as somebody who's deeply spiritual, kind of growing up in a very religious community, hearing axioms like die before you die, do your accounting now, and I've always, as a clinician who used to practice, but I don't anymore, I was always the type who really enjoyed, which is a weird way to say it, but I really enjoyed being in the company of family who are in the last moments with their loved ones, because at that moment, really what is therapeutic are the words that you say, right? So I look at this work as being very sacred. I'm always incredibly humbled to speak with families who are the experts on the patients, and we're just lucky to be there and see if we can make that process a little bit better. So earlier, like last year, when I had heard this opportunity, was available, and I was introduced to Jessica, our founder and CEO, I said yes after a couple of quick phone calls.
Well, Raihan, thank you for sharing. Incredible story. I hadn't heard that. I really appreciate you sharing, and certainly resonate with my patient story, with so much of what you've said in that recovery aspect and that close tie. So thank you. And having met Jessica, I completely felt that this past week. Was lucky enough to feel that same kind of just incredible energy and direction and focus. And for that reason, I'm just really optimistic about what you're all doing. Uh, as a clinician who has made this transition and is now been actively involved in seeing and supporting technologies that are coming into the clinical space, I'd love to just kind of wrap up here with asking you a question around escape velocity. And I know it's a term that we hear a lot in technology, and I'm curious to hear, what does it mean to you in the context of your mission at Guarantee? Where do you think you and your team will be able to achieve escape velocity over the next year, couple of years, or aspirationally, overall mission?
Yeah, I actually haven't heard that term before, Tim. Give me some
Here we
more
go.
context. Yeah,
Sure. So it could be the unlock. It could be
yeah,
in this. This is our second expedition, so we are kind of a future mission based
right.
show here, and our audience wants to hear kind of the what are the bets that you're making, and
Yeah,
what are the things, the dynamics that'll allow you to actually
sure.
achieve your moonshot.
Yeah. So, we're a technology company, which means that we believe in the power of harnessing data, for the good of our mission. We're trying to help people die better, which means that there's a lot of data that we are hoping to collect at the end of life. How do we build a data driven patient and family experience from some aging time point, right? Maybe you're 55, you have a couple of chronic conditions. Death is not top of mind, but maybe you've experienced family members or people in your circle, and you're starting to think about it, all the way to bereavement after you've passed away, and your family is now dealing with grief. So that is the timeline that we are looking at, which is a very broad timeline. And we are really excited by the different types of data that we can collect from your typical claims data, right, from insurance payers, clinical data from EMR, but then really patient-reported data. Patients say things and they're ignored all the time. Family data, right? Family-reported data, physiological data, as we think about vitals monitoring and how we can actually predict the last week, predict the last 24 hours of death, and how we can educate and then guide family, caregivers, and patients. How we are looking at pain data, both subjective but objective measures of data, and how a lot of this data can unlock a reimagining of what care can look like through the best in-person but virtual care. And it's really that virtual care that we as a technology company are bullish on, where we understand that our care demand is exponentially only increasing across all care demographics and verticals, but our supply of providers is not. And what we have, though, is we have patients and we have families who are hungry for education and guidance. So how are we able to build self-service and empowerment mechanisms through text, through video, through rich educational portals, through multimedia, video, audio, graphics, text, and then really build a kind of a system that can, again, help people take care of themselves when necessary, without having a provider right there in front of you, which is very difficult to scale in our space. And do this in a way that is culturally competent, where we have providers and builders who are diverse. There's a real challenge at the end of life because there's such a diversity of experience, from faith to lack of faith to background, nationality, sexuality, and just the entire compendium of diversity. But we're trying to be representative of that, but really provide tools that can allow us to represent some of that diversity at the end of life. There really is a lack of utilization of great end of life care amongst underrepresented groups, and we're hoping to make a dent in that.
Well, I'm more hopeful because of you, because of your mission, and such an aspirational one, and one that I feel great about, and I'm thankful and grateful for the work that you're doing to improve so many lives and deaths. So thank you, Raihan. Great having you on. I appreciate you joining me on T-10, and hope to see you soon.
Thank you so much, Tim.